My name is Leigh-Anne Tu, and I'm a hand and upper extremity surgeon. I hope to approach patient care as a team. What I mean by that is that I hope to empower my patients with knowledge about their diagnosis, about their disease, and that together we create a team approach to their treatment, because I believe that, not every treatment is appropriate for every single patient, and I think it should be tailored. I was originally interested in orthopedic surgery just because it's kind of the ability to directly impact quality of life and being able to get patients back to doing what they love. What I really enjoy about hand surgery particularly is the variety of pathology and the variety of patients that come in. So treating anybody from a kid to somebody older. When you fix a fracture or when you treat something as simple as carpal tunnel, the biggest thing kind of causing them pain or daily dysfunction, and being able to make a tangible effect in that regards and make them feel comfortable afterwards is the greatest reward. I guess I'm lucky in that I haven't had a lot of injuries, but being pregnant, you kind of experience a lot of the hand pathologies, as in carpal tunnel and decar veins, and seeing a patient with either or, I can kind of counsel them. I know exactly how they feel about it, how miserable it can be, and so I think they appreciate that, I have also gone through something similar.